Good afternoon, and welcome to Live Healthy Miami Gardens Facebook Live Weekly Wellness, Health, and Wellness Series, brought to you by the City of Miami Gardens, Live Healthy Miami Gardens, where we bring you and your family information and resources to help you and your families receive the best resources possible to help our Miami Gardens community make the healthiest choices possible for ourselves. I'm your host for today, KeTia Harris. I'm also serve as Community Health Data Specialist at Jessie Trice Community Health System, Program Manager of our Breastfeeding Touchpoint Program, and am a Live Healthy Miami Gardens member. So, Live Healthy Miami Gardens was born from the realization that although health is largely influenced by our individual choices, the conditions in the communities where we live, learn, work, worship, and play are also major contributing factors to the racial and ethnic health disparities faced, as well as our overall ability to make healthier choices. We know that these conditions are systemic, historical, and continue to impact us as communities of color and as a whole here and now. Live Healthy Miami Gardens is a community initiative and part of the city's efforts to address these conditions and reduce poor health outcomes through the transformation of policies, our environment, and the healthcare system overall, making the city of Miami Gardens a healthier place to be. Joining us today in the heart of flu season and as we prepare to kick off National Flu Vaccination Week is Sydney Augustine, community health worker for the vaccination program at Center for Families and Child Enrichment, or CFCE, a member of and our member of the Primary Care Mental Health Sub Council with Live Healthy Miami Gardens. Sydney, thank you so much for joining us today. Could you tell us a little bit about yourself as well as CFCE?
Thank you so much for having me, everyone. It's great to be here. This is my first time on the live with, so it's a new experience for me. So my name is Sydney Augustine, and I serve as a community health worker with CFCE, Center for Family and Child Enrichment, under the Pediatric and Family Health and Wellness Center, which is our FHQC. I'm basically supporting, engaging, and advocating for our community and educating them on the health disparities in our community, most specifically with COVID and flu that's going on right now. So, CFCE is a private nonprofit community based organization that serves children welfare in any capacity if they've been abused, neglected, abandoned, if they have emotional or mental health needs, if they just need to enrich helping children and helping families get a better lifestyle, better living, and just building a stronger community. So with our FHQC, the Pediatric and Family Health and Wellness Center, it's our clinic that provides preventative health services. We include general and family medicine, pediatric care for children. We are going to be offering OBGYN services soon, but we offer dental services, nutrition programs, behavioral health, and mental health services. And then we also, for the sake of this live, want to let you guys know we also offer the Nurse and Family Partnership for young expecting mothers. So if that's a program that they want to look into, it's really great. They make sure they help the young mothers that's expecting, and it's a really great program. So it's definitely something to look into. Yeah.
Beautiful, and I'm glad you mentioned all of that too. I'm actually, me and my daughter are actually a product of the Nurse Family Partnership, and
Really?
yeah, it was. I don't know. I could talk about that. That could be a separate live altogether, but it's a beautiful program. So I'm glad to hear that you are all to hear about all the programs that Pediatric Health and Wellness Center is offering and does offer. Could you tell us about your vaccination program?
Yes. So basically, our vaccination program here, we're partnering with Live Healthy Miami Gardens as well. So we offer free flu and COVID vaccines Wednesdays and Fridays for specific hours. We have a 9 to 1 on one day, and then we have like a 1 to 4 on another day. So it's free. You can come get a free COVID and flu vaccine. We sometimes go out specifically in the community. People we worked with in the past is like Job Corps. We go out and give organizations try to be on site and give them free vaccinations. Just trying to get in the community and make sure we get the people in our community vaccinated.
Okay, and thank you for your work. I mean, we know that National Flu Vaccination Week is less than what, 2 weeks away?
Less than 2 weeks away.
So why is it important for our communities to get our annual flu shot, or is it even important? Like, what is the risk of me missing this year's shot?
Okay, so it's very important to get your vaccination. It can keep you from getting the flu. It can reduce your risk of hospitalization if you do get the flu, and then it helps protect the people around you. You want to protect your family and friends who might have um, immune deficiencies, anything like that. You want to make sure the people around you are safe. So you getting vaccinated is like that first step, just making it happen in the community. And it's important. You do run a risk. So if you miss, like, say you're missing a vaccine for the year or anything like that, the protection against the flu vaccine declines over time. So if you miss one, if you get a yearly protection is the best way to be protected against the flu. So everything is always evolving, so you just want to make sure you're up to date with your vaccinations year to year.
Okay. And I know you mentioned that it's not just about protect. I mean, we want to protect ourselves. But it's not just about protecting ourselves, but even the ones we love, and maybe the ones we hate. It's just about protecting everybody.
Exactly. It's about protecting everybody, no matter what.
Okay, and out of everybody, who is because when I think about that, I do think about my grandmother and some family that might have, or even like friends that might have some chronic diseases or some barriers that might not have allowed them to be at their best optimal health as they would like. So I say all that to say I probably didn't even have to say all that, but who is most at risk?
So your point does stand, because we do want to think about our elders. So right now, the statistics are showing that adults and seniors 65 years and older are most likely at risk. Children younger than 5 are at most at risk right now, and pregnant women are more susceptible to potentially serious flu complications. So they should definitely be researching and checking in to make sure they're up to date with their vaccinations as well. It's just due to things with the immune system when you're pregnant, like your lungs, your chest, all that can cause complications. So it's just important to just make sure, getting the flu vaccine is just another precaution just to make sure you're okay.
Okay. And during your work, have you noticed any what have you noticed, in the answer like that, about our community's feelings towards getting the flu shot in your work?
Okay, just so a transparency moment, because we're making this like a conversation, just to get to know me more. So I started working with CFCE like over this summer, and I just been really just going into the community as soon as I started, and just seeing, especially with the COVID and the flu vaccine, seeing what people were feeling, and a lot of people lack confidence, or they're complacent, or they're just it's not convenient for them to get the vaccine. So if they're lacking confidence, they feel like there's some mistrust or anything with the vaccine, or they're not doing research, or things that they've heard that may not be true, or definitely will not be true, they'll take it to heart without doing their own research or speaking to a doctor, and that'll stop them from getting the flu vaccine.
Mm.
And just if it's far from them, or they don't have the means, the funds, or insurance, then they won't try to get the vaccine. If it's more convenient for them, people will definitely, if there's like a pop-up clinic offering the flu vaccine for free, they're definitely gonna, feel like, okay, well, it's not hurting me, it's not taking away from anything that I have going on. I could just go buy and get the flu vaccine. Like people who, when they offer it to your jobs, they set up clinics at your jobs and stuff. That makes it easier for people, so they don't have to miss work or anything, because that's something people worry about. Like, I can't miss work to go get the flu vaccine, or things like that. I don't want to lose hours or just be stuck in traffic trying to go get the flu vaccine. So that's something. Another is just like people are complacent. They feel like, if I didn't get sick, nobody I know got sick, then why do I need to get the flu vaccine? But you never know, right? You never know. It could just be randomly, like, just like a lot, especially even though we're speaking about the flu with COVID, that's a prime example. A lot of people are like, I'm not gonna get COVID. Like, I'm not worried about that. And so when they do get it, then they're like, oh my God, let me start doing research now. Let me see what I can find out. And that's with the flu. Like, people just like, I never got flu in my 18 years of living. I'm not gonna go get the flu shot. And then boom, 1 year they get it, and it's like the end of the world to them. And they're just like, let me go research. And it's just that's the point. Researching that can, battle the barriers that we're seeing in the community of why people aren't getting the flu vaccine.
Okay. And even in addressing those barriers to getting vaccinated, including um, lack of insurance. Although I know, do they need insurance to get vaccinated at CFC? I mean,
So
at
no, you
CFC
just
offices?
if you come on those specific days for flu vaccination, you just come in and we're offering it for free. You just
Okay.
come. You're in our community. You're here. We're trying to make sure you're safe and you're healthy. You can come get the flu
Okay.
vaccine.
So you ensuring there's no barriers, at least on the clinics and for patients or the community to get access to the flu vaccine. That's
Yes.
beautiful. So in talking about barriers, what do you see on the flip side, the most common or biggest motivational factor in our community or from our communities to get vaccinated?
So, like I was saying, that on the other side, convenience. So, like when
Mhm.
people see that it's convenient to get the vaccine, they go get it. If they see they're coming to my job, I might as well get it. Or they're right there at the Walgreens that I'm going to. They have a pop up shop happening. Well, I might as well get it while I'm here. So when it's convenient, people go get it. It's free. It's all of that. They'll go get it. And then another one would be basically if they need it for a reason, like if they have a trip coming up, or for their job, if it's required or something that can uproot their plans, then that motivates them to go get the vaccine.
Okay, thank you. And the question for our life, because this is the breastfeeding masterclass. We want to make sure um, that everyone does have access, but want to make sure it's also safe for our communities
Hmm.
if they decide to. So, are flu shots safe for breastfeeding families, especially the breastfeeding mom?
Yes. So the flu vaccination is safe for breastfeeding women and their infants 6 months and older. So it is safe for them. If you do, like, especially if you do get the flu vaccine while pregnant or breastfeeding, you help develop antibodies against the flu, and you can share that with your infants through breast milk. So it is there's this is something that if you feel like you need to see with your own eyes, you can research it as well. It's out there. um, so yes, the answer
Okay.
is yes.
Okay. And I know you mentioned something about 6 months. So the mom is wants to get the flu shot, but she's currently not necessarily she's pregnant, but she's currently breastfeeding. She should wait till the baby is at least 6 months for her to.
No, so basically if you're breastfeeding already and
Mhm.
there it is saying that your infant should be 6 months and older. Basic, that's what you were asking, right? Yeah, your
Okay.
infant should be six
So I
months
know
and
you mentioned something
older.
about 6 months. I was just gonna getting clarification.
Yes.
Okay. Okay. Awesome. And then what about COVID-19 vaccines? Are those safe for breastfeeding moms? So I know your project deals with both. So I just want.
So it is there's no evidence or anything that it is harmful to breastfeeding moms. There has been nothing shown in any statistics or any research that's showing that if breastfeeding or pregnant moms are getting the COVID vaccine, there's an effect to their child or anything like that. There's nothing out there, so it is not harmful to go ahead and get the COVID vaccine. Like, it is recommended by the CDC that women who are pregnant or breastfeeding can go get the COVID vaccine now and be up to date with the vaccine and booster shots and everything.
Okay. And I'm glad you even mentioned, I guess it's also, I guess, applicable with the COVID-19 vaccine, but I'm glad you mentioned with the flu vaccine that about the benefit for the baby with the antibodies. Breast
Exactly.
milk is so interesting. Just the human body in general is so amazing and how it transforms to the needs of both the mommy and baby. So to have the vaccination not only benefit mom but the breastfeeding baby as well. That's, I don't know, it's beautiful.
It's important. I know there's women who's thinking about that. I can't just take something for me. I have to make sure it's okay for my child. What is the effect going to happen to the child while it's in my stomach? What is the effect going to happen to the child while and when I give birth? And I'm trying to, provide the necessary nutrients. You don't want to pass anything off to your child on accident or anything without doing, research or questioning or asking questions. So that's why it's important to make sure you're talking to your primary health providers or your doctors or the medical community around you just to, get some clarification on what's going on.
I know earlier you also discussed, let's go back to earlier. You're discussing, the benefit or the advantage, the motivational factor for getting the flu shot, the COVID shot is if you want to travel. And I know during the holiday season, we want to travel.
Exactly.
So as we're preparing for the holiday season, or just because, do you have any upcoming events or activities for families to get their flu and COVID-19 shots and boosters?
So I'm glad you asked. So we do know that National Influenza Week is from December 5th to the 9th this year. And so December 6th, we are partnering with Live Healthy Miami Gardens, and we're doing a free flu vaccination day outside of the regular days that we already do. So Tuesday, December 6th, from 11 p.m. to 6 p.m., we will be offering free flu vaccines. And we're going to be out in the community doing outreach, promoting, letting everybody know so they can schedule an appointment and come get a free flu vaccine. Letting their parents, letting their grandparents, letting everybody know to come and get a free flu vaccine.
And you said this is at CFCE Tuesday, December 6th, from what time to what time?
From 11 a.m. to 6 p.m.
Yeah, please don't have it at 11 p.m.
I know, not 11 p.m., 11 a.m.
Okay. So any activities beyond flu vaccination week?
Yes, so we are also partnering with WMBM. It's a gospel radio station, and we have been doing events with them. So they are having a toy drive December 10th, and we will possibly be out there. We are going to be out there regardless, doing free giveaways and things like that, hand sanitizer, necessary things. But we may be also offering vaccination that day as well.
Okay. All right. So thank you for that. I'm glad you see that all these events are and opportunities for our communities to get vaccinated and just to access other resources that we're offering for our community by our community are being made available. Um, what is your call to action, or would you have a call to action? Just to summarize.
So definitely follow us on all social media platforms so you can be up to date with everything that we have going on, everything that's upcoming. So you can follow us at CFCE Inc. on all social media platforms or PFH Wellness on all social media platforms. And then another call to action would be to call to schedule an appointment ASAP for our flu vaccination day on December 6th. You can call us at the number that's on the screen, and you can ask for our clinic or anything like that to be directed to our clinic so you can schedule your flu vaccinations.
Okay. And maybe I'm kind of like years late asking this. PH Pediatric Health and Wellness Center, is that a subcomponent of CFCE, or how is that related?
Yeah, so that's our federal health clinic that's operating under CFCE. So that's our FHQC basically. So we're under CF. We are CFCE, but we're under CFCE. That's where all our medical clinic, our behavioral health, mental health services, all of that operates under that umbrella.
Okay, beautiful. Thank you for the clarification. Any final thoughts before we close out?
I think this is a great broadcast that you guys are doing, and it's important to get this information out in the clinic, and it's important for people to be aware of the services that's being offered, especially if you're lacking in any resources or insurance or anything like that, just to make sure you're researching on what's being offered in the community, because we want to help all of the people in our community get a healthier living.
All right, appreciate it. Thank you once again, Sydney. Thank you all for joining. If you're joining live or you're joining later, let us know what you took away from the discussion. Share your thoughts in the comments. Also, let us know what breastfeeding or breastfeeding adjacent topics that you'd like to hear us talk about, or which guests you would like to join us on the breastfeeding masterclass. Again, please come out on Tuesday, December 6th from 11 a.m. to 6 p.m. for Pediatric Health and Wellness Center's flu vaccination week event. And it's going to be located at the Pediatric Health and Wellness Center, you said?
Yes,
Oh,
yes, it will be.
okay, sorry. Also join us for our in-person and virtual breastfeeding cafe support group hosted by Jessie Trice Community Health System and Miami-Dade WIC. We're actually hosting one this evening at Jessie Trice's Barbara Jordan Center in Miami Gardens at 5:30 p.m., in which Florida Impact will also be joining us to speak a little on nutrition. Also check out our link tree. You'll see it right above the ticker. And follow Live Healthy Miami Gardens here on Facebook and YouTube, where we go live with our weekly wellness series every Tuesday at 3 p.m., including our breastfeeding masterclass every fourth Tuesday at the same time. We're also on Instagram, Twitter, and at livehealthymiamigardens.com, offering more health content and resources for you and for our community. Thank you for tuning in. Sydney, thank you again. If you're viewing after, thanks for viewing a little bit later. Please share and have a great rest of your day, week, happy Thanksgiving, etc., and live healthy.
Thank you, everyone.